Have you heard of pressure injuries? Did you know that around 100,000 patients will develop a pressure injury in Australian hospitals each year, and that almost all of these are preventable? And that this costs our health system about $1.8 billion each year? This Thursday, the 21st of November, is Worldwide Pressure Injury Prevention Day. So I thought I'd play my part in raising awareness by explaining pressure injuries and their impact on patients. Estimates of incidence and prevalence vary, but something that we know for sure is that Australian hospitals reported that 3,850 of their patients developed one of the most serious stage 3 or stage 4 pressure injuries during their hospital stay in the year ending 30 June 2018. These are really serious wounds that develop deep in the tissue over bony prominences such as the heel or the sacrum. Stage 3 pressure injuries involve full thickness skin loss to the extent that fat is visible, and stage 4 pressure injuries are even deeper, potentially exposing muscles, tendon and bone at the base of the wound. So that's almost 4,000 Australians facing months or years of painful treatment and recovery. These wounds have a huge impact on quality of life, affecting mobility and people's ability to undertake normal daily activities or employment. They're also at risk of infection or even death in severe cases. But it's often the emotional impact and social isolation that is the most devastating. As one patient explains, "The wound controls my life. I have a special bed, limited positions, dressing changes, home health, odour and drainage, clothing limitations. I cope. I'm fairly isolated." The good news is that some fascinating research has transformed our understanding of how pressure injuries occur and what we can do to prevent them. Our traditional explanations of pressure injuries used to emphasise ischemia, that is, that blood vessels are occluded and block the blood flow to tissues, causing them to die. But in 2006, a group of researchers revisited some old research that used animal models to test how long muscle tissue could tolerate certain pressures before it succumbed to irreversible cell death. They plotted their results along with the earlier results on a chart and found that there was a marked drop-off in tissue tolerance after 1 to 2 hours. At the time this was published, it was already known that cell death due to ischemia alone takes up to 6 to 8 hours, so people had begun to speculate that tissue deformation, or the squashing of cells, was also a factor. Two years later, the same group had developed artificial bioengineered muscle tissue that had all the same properties of real tissue but no blood vessels. They performed the same pressure tests using this artificial tissue and found a remarkably similar pattern and tolerance to pressure. Since this model completely excludes ischemia as an explanation for the cell death, this research confirmed tissue deformation as the primary cause of pressure injury formation in the early stages. Research in the years since has revealed a lot more about the mechanisms by which sustained tissue deformation causes cell death, including damaging cell structures, increasing membrane permeability, and impaired transport of large molecules. Ischemia is still an important factor, but occurs much later in the pressure injury formation process. So if we fast forward to 2019, we now have a model that describes 3 major contributors to pressure injury formation: initial damage through direct tissue deformation, inflammatory cell death that occurs when these dead cells release their contents to the surrounding tissue, and finally, ischemic damage. The overall rate and extent of tissue damage is the cumulative effect of these 3 factors. So if you're new to the topic, I hope you've learnt something from this very rapid tour and introduction to the issue of pressure injuries. And if you'd like to learn more, then I'd really encourage you to check out the Wounds Australia website, or perhaps consider downloading the latest international clinical practice guidelines that were released just last Friday. And lastly, I'd like to acknowledge and thank the many inspiring and passionate clinicians and nurses that are working in this space every day. We can prevent pressure injuries.